Today I'm going to talk about hemostasis. This is a system that is used to stop any bleeding as quickly as possible. Typically, hemostasis involves three principles: vascular spasm, platelet formation, and the clotting cascade. Firstly, when we bleed, cells adjacent to the injury will release endothelium. This causes vasoconstriction. However, this is only a short-term measure, as the vessels will eventually relax. Platelet formation is the second step in preventing bleeding. Platelets normally flow freely in the blood. However, when they come in contact with collagen from damaged blood vessels, they become sticky. They stick to the vessel and to each other. The platelets also release ADP and thromboxane A2. This makes the platelets even more sticky. This allows the body to create an even bigger plug to stop bleeding. So in brief, platelets come in contact with collagen, they become sticky and stick to the tissue and each other. They release ADP and thromboxane A2, which makes them more sticky and adhesive. They form an even bigger plug to stop the bleeding. This platelet plugging is prevented in normal blood vessels by a substance known as prostacyclin. As the platelet plug is only a temporary structure, we need the coagulation cascade to take effect. Clotting can be activated by two mechanisms: the intrinsic or extrinsic pathway. The intrinsic pathway occurs when blood is exposed to abnormal surface such as collagen on a damaged blood vessel. The extrinsic pathway occurs when the damaged tissue releases a substance known as tissue factor. There are a number of factors in the pathways, and these are denoted as Roman numerals. Factors can be active or inactive. If the factor has an A afterwards, it means that it is active. The two pathways come together at the activation of factor 10. This is known as the common pathway. The purpose of the coagulation cascade is to create thrombin, which converts fibrinogen into fibrin, and fibrin stabilizes the clot. Now to look at the extrinsic and intrinsic pathways in more detail. So, in the intrinsic pathway, it begins when an inactive factor 12 is converted to an active factor 12. This will help convert factor 11 into active factor 11. And this goes so forth like a domino chain. We then have an inactive factor 9 converted to an active factor 9. This active factor 9 will help convert factor 10 to its active form. It does this with the help of factor 8. And that starts us off on the common pathway. So, in summary, it starts off with factor 12 becoming the active factor 12, and this active factor 12 helps the conversion of factor 11 to active factor 11, and active factor 11 then helps the conversion of factor 9 to active factor 9, and then we get to an important stage where factor 10 is activated, and this is done so by active factor 9 and factor 8. It is the factor 10 that is pretty important in the pathway, as it helps convert thrombinogen to thrombin. And it does this with the help of factor 5. This active factor 5 has of course came from an inactive factor 5. The thrombin will convert fibrinogen to fibrin, and the difference between fibrinogen and fibrin is that fibrin is an insoluble form, so it's a good mash to form a clot, whereas fibrinogen is soluble. So that summarizes the intrinsic pathway. The extrinsic pathway, on the other hand, begins when factor 7 is converted to active factor 7. This combines with tissue factor, and remember we talked about how tissue factor was an important part of the extrinsic pathway. So with active factor 7 and tissue factor, they convert factor 10 to its active form. And then we have the same process. So remember I spoke about how the intrinsic and extrinsic pathway are different for the first parts of the pathways, and then they converge to form a common pathway, and this is when factor 10 is activated. That is the convergence of the two pathways. So this concludes my talk on hemostasis. Thank you for listening. If you liked this video, please hit the like button and subscribe to see other medical education videos on this channel.